Hey, I'm Dr. Karnik again. I'm a pediatric neurologist practicing for about 40 years, and I have seen many thousands of children. So I'm going to give little idea what we do uh, to manage children with ADHD. We are going to concentrate today a little bit on brain nutrition, how it's important in managing ADHD and many other brain functions. And this is an overview. And then next time we'll go in depth with regards to every element you see here that is right behind on my whiteboard. So it's important to know that brain nutrition is a part and parcel of management of children with ADHD. It's not just medication, it's not just other things. You've got to include it to get optimal results. And in my clinical practice, I have seen whenever I use this as a part of our therapy, I had much better success. And as a matter of fact, some of my patients who have ADHD, and that includes significant ADHD, not just mild, they are only on brain nutrition and they're doing well, and we could take them off medication. So they work, and we'll see what they are and why they're important and how we correct nutritional deficiency in children with this condition. Now, why diet is important? As probably you know, as a parent, that children may not eat well. Their appetite may be low, or they have time concentrating on the appetite, or the changes that we have seen in nutrition all over the world may lead to some deficiencies on their nutrition. So it's not uncommon to see that they're deficient in omega-3s or some magnesium or zinc or vitamins or other nutrients or proteins. And if you don't replenish them and you don't support that brain nutrition, then the medications may not be as effective. So it is quite important to give them a good nutrient. And it's important anyway, not just for ADHD. Your children and adults need a quite well balanced diet. Now, in ADHD, we have deficiencies of some element that has been shown by research, and therefore what we are trying to do is we're going to replenish those stores. Now, what are important? The very first thing is omega-3. Studies have shown that if you give omega-3, especially EPA, which is one form of omega, then you may improve their behavior, and that is attention or impulsivity, or they blend well in group situations. Now, we have many forms of omega-3s and omega-6 and omega-9. Research has shown that omega-3, especially in the right kind of concentration, is important. Now, omega-3 you will find in fish or fish oil, or you will also find in some naturally occurring products which are derived from vegetarian source. So it's not just fish is the source, and so you'll find those kind of things. But what you need to find is to make sure that they have EPA and DHA, because those are the ones that are important. Studies have also shown that when you give EPA more than DHA, it's useful for attention and behavior. Now, that's what we recommend, and we recommend with close to 1,000 to 1,500 milligrams a day, and your physician will decide how much is appropriate dose. This lecture is just to give you an idea about nutrient, but not recommendation for your child, or if you're an adult, these are not our recommendations. You seek those with your physician. Now, the other one that we use are magnesium. Now, magnesium and zinc are very important, and studies have shown that children with ADHD may have deficiency of magnesium or zinc. And also, studies have shown that if you replenish them, then there will be an improvement in their behavior. Now, the doses vary. Especially, you have to be careful with zinc. As I said, we'll see that in detail during my next talk. But zinc, you have to be careful because it accumulates in body system, so you don't give them indiscriminately. Now, magnesium, the same story, but magnesium, if you give high doses, then they may have GI symptoms like loose bowel movement or abdominal cramp. So you got to make sure that you give them in a right amount. Now, these ingredients, especially magnesium, can cause improvement in ADHD, but they also help them from sleep and relaxation point of view, and therefore it may have some other effect which are positive in children with ADHD. Vitamin B6 can help to improve symptoms of ADHD. It may help to improve metabolism of dopamine and norepinephrine, so that could be useful. As we go down, same thing with vitamin B12 and methylated folic acid. And we do use that routinely in our ingredient in order to improve methylation, in order to improve metabolism inside the brain and the overall brain function. Now, some children have what we call MTFHR deficiency. And if they have MTFHR deficiency, then the nutritional folic acid does not get to the brain, and therefore they need a different form of folic acid, and that is called methylated form of folic acid. And that's why that form can be useful in children with ADHD. Now, as probably you know, many patients with ADHD, they have problem with memory, especially short memory. And as a result of that, they may not remember or they may not comprehend very well. And product or addition of phosphatidylserine, which eventually convert into choline, and that's important for memory, that can be useful. Alpha GPC does the same thing. It improves memory, and those are going to be useful for children with this condition. Now, all this, if you try to get in market, then you have to get different product, which can be cumbersome. So therefore, it's good to have a product that has these together. Now, we are designing and developing product, and very soon it will be available for children to improve their nutritional balance if they have some conditions like ADHD. For any further information, please go to our website, and that is www.brainmindbody.com. And in my next lecture, I'll be going in detail about different nutrition that will be useful for brain. So thank you again for joining me today. My name is Dr. Karnik, and I'm a pediatric neurologist, and more information will be available on our website, brainmindbody.com. Thank you. Have a great day.